Or 30 seconds? Oh, no, I don't. Okay, good. Okay. Should we shut this door or? Yeah, I think so. Thank you, Ellis. Well, good evening, everyone. On behalf of Prevention Access Campaign, welcome to the Mississippi Meeting of the Minds on National Black HIV/AIDS Awareness Day. I'm really excited to have you at the Jackson State University, right? Thank you all for joining us in person and virtually. I'm not sure of the count right now, but I can see and hear this was pretty good attendance. And I know that online we had pretty good attendance as far as people signing up. So I'm excited about that. I'm Dr. Zundra Bateaste-Sutton, for those of you who don't know me. The founder of Cry Out Teen Organization. I'm also a U equals U outreach coordinator and for Prevention Access Campaign. Before I share a little bit about Prevention Access Campaign, I want us all to take a moment of silence to reflect on the lives that have been lost to HIV and AIDS over the past 40 years. Just a moment. Thank you. Prevention Access Campaign, PAC, and partners launched the U equals U campaign in 2016 and to build and communicate a consensus about the largely unknown fact people living with HIV who are on treatment and have undetectable viral loads cannot sexually transmit HIV. Today, U equals U is a thriving and growing community-led movement of HIV advocates, activists, researchers, and over 1,050 community partners from 105 countries. Together, we're changing what it means to live and love with HIV around the world. We've been in partnership with MSCH since last year, working to educate the state about U equals U as a part of the larger Ending the Epidemic initiative. PAC's mission is to end the dual epidemics of HIV and HIV-related stigma by empowering people living with HIV with accurate and meaningful information about their social, sexual, and reproductive health. Our vision is that U equals U will become common knowledge and that all people living with HIV will have access to the care and treatment to achieve it. We envision a world where all people with HIV can live full and healthy lives without the fear of transmitting HIV. However, we know that is not the current reality today. Today on National Black HIV/AIDS Awareness Day, we wanted to gather together in hopes to answer some important questions about HIV in the Black community in Mississippi. How can we leverage U equals U to eliminate health disparities and get us to ending the epidemic? How do we actually fight stigma? We've gathered an excellent panel here today to help us think through the importance of this day and how we can work together to end HIV and HIV stigma in the Black community. I'll let these esteemed panelists introduce themselves. So I'll start with Ms. Deja, please.
Thank you so much. Good evening. My name is Deja Abdul-Haqq. I am the Director of Organizational Development with My Brother's Keeper and Open Arms Healthcare Center. For the past 20 years, I've worked directly and indirectly in health equity. And my work with My Brother's Keeper has amplified that passion. I do have a specific vested interest in Jackson, Mississippi. It is home for me, but it also serves as the epicenter of health inequity. So I feel like when we create a solution that lifts us out of that position, we don't just fix Jackson or we don't just heal Mississippi. A solution in Jackson is a solution for the nation.
I don't know how to come behind that one.
You don't either, girl.
I know.
Right.
Yes, say mine for me. Good afternoon. My name is Dr. Talya Straughter. I am a professional secret keeper, meaning I am a licensed professional counselor, and I've been in the field for about almost 20 years as well. I am passionate about people's mental health, and not only just people, but African Americans in general, because historically we don't tend to our mental health. So I am passionate about healing my community. And so if my community is healed, then the generations after me will be healed as well.
My little voice. Good evening, everyone. I'm Melverta, the Director of the Office of STD HIV at the Mississippi State Department of Health. I'm also the Principal Investigator and Project Director for Mississippi Ending the Epidemic. In the Office of STD HIV, we have programs that focus on prevention, education, surveillance, epidemiology, research, care and treatment for both STDs and HIV. We support a comprehensive STD clinic, Ryan White Part B, as well as a Ryan White Part B dental clinic. I am pleased and very excited to be joining this panel, and we've known each other, three of us, for a very long time. So we've been in this work for a really long time, and I was saying earlier, I am really excited about training and preparing the next generation to take the baton. The three of us started and have continued this work, and we have stories that people probably wouldn't even believe based on what we're dealing with now. So the partnership that the health department has with Prevention Access Campaign is a long time coming, and I'm excited to be a part of it.
Good evening, everyone. I greet each of you with light and extreme love. In my consciousness, light means living in good health, healing, and truth. That's something we all need. So I never quite know how I want to introduce myself or answer this question. I'll start with what I'm most passionate about. I'm passionate about people, passionate about meeting the needs of people across several sectors, especially marginalized communities. So I am currently a U=U Mississippi Outreach Coordinator with Prevention Access Campaign. I'm also still an independent consultant with my own brand that I've been building now for a few years, LSJ Inc. I am still a licensed and ordained minister. I'm a singer. I've done a lot of things, but in the 5 years that I've been in this work professionally, I think what I've gained the most is the love for making sure that no other person has the experience that I had the day that I was diagnosed with HIV. And I have seen a lot of change in these almost 8 years from when I was diagnosed. The person who gave me my results doesn't even deliver the same way. So that's what drives me. I like to see change. I like to see action. I'm tired of talking and it's time to do. That's me.
Thank you. Thank you. With a panel like this, we gotta know that the discussion tonight is gonna be good. Let's jump right in. Now, of course, I'm a little bit partial to this question. That's why I wanted to hit you with it first. Why is U=U important on National Black HIV/AIDS and Awareness Day? This question is for each one of you. So we'll start, let's see. Let's start with you, Melverta.
Why is it important? When we were working on the ending HIV epidemic plan for Mississippi, there was more than a cursory reference to U=U, but we didn't have a partnership with U=U. The state did not have a partnership with Prevention Access Campaign. And I felt with all of the conversations that were taking place that we needed to have this partnership, which I think is going to grow and grow. So there are a lot of prevention programs that are, for people at risk or anyone who wants to get tested. But there was nothing specific for people who are already HIV positive that needed to be empowered, that needed to understand what U equals U actually means and how they can apply it to themselves. There's one thing to hear the slogan, but there's another thing to be able to act upon it and apply it to oneself. So we empower people. We have interventions that always talk about prevention, but what was there, that we had in our arsenal, that was specific for people who were HIV positive. So as we are celebrating National Black HIV/AIDS Awareness Day, I'm really proud of this partnership. I mean, all of our partnerships, but I remember when U equals U was being talked about and going to conferences, and I never understood why we didn't have anything here necessarily in Mississippi. It's new, we're feeling our way. The PAC team is ready to get their feet wet and do whatever needs to be done to support our efforts in Mississippi. I implore you to call upon them. We're supporting them through the health department for the work that they're doing, so they are available. And so for National Black HIV/AIDS Awareness Day, having us move towards educating people who are HIV positive and educating other people that HIV, is not the death sentence it used to be. People who are HIV positive can have families, they can have children, they can work and have productive lives. And we need to really understand that from that perspective.
Yes. Well said. Dr. Talya, or Dr. T, as we often say. Why is U equals U important on National Black HIV/AIDS Awareness Day?
Coming from a mental health perspective, I believe U equals U is important on National HIV Awareness Day, because if your mind is not right, your body is going to follow wherever your mind goes. The thought starts in your mind. So your health starts with your mind. Think about it. All of us have mental health. We all have a brain. And so if we're not well and we're having those thoughts, or we're feeling bad about ourselves, or we're depressed, or we're having anxiety, or we're overwhelmed, or we're stressed, that's only going to exacerbate what's going on in our bodies as well. So our thoughts trickle down and cause behavior, and that behavior causes a mood. So it's like a domino effect. It's almost like, I tell my clients sometimes, it's when your car is out of alignment. It pulls to a certain, it might pull to the right. So that's going to mess up your tires. That's going to mess up your engine. You're going to use more gas. So we're the same way. If we are out of alignment, then we are messed up as well. So we need to make sure from a mental health perspective that our brains are healthy so we can take care of ourselves. Because if I can put something out there positive to take care of myself and not discredit what happened to me, not discrediting the trauma, but not letting the trauma encompass who I am as a person. So I think that is why it's important.
Exactly. I
Love
love the
that.
car analogy. I think we all have had a janky car.
Oh, yeah.
I want to pose that same question. Let's see, to you, Ellis. Why is U equals? I'm sorry. Go ahead.
This is a loaded question. I mean, 2017, the CDC published data that says 1 in every 8 African-American men, regardless of sexual orientation, regardless of socioeconomic status, if you take 8 Black men and line us up, the data says that 1 of us are most likely living with HIV and don't know it. That's why this matters today. When we talk about the 36,000 cases, new HIV cases last year, and a disproportionate amount of those were people of color, and even more so Black women. So why is this message important? Because U equals U is a biomedical tool. It is a prevention tool. It is a treatment adherence tool. It is a tool to address social determinants of health. What other tool does all of these things to people who have been marginalized, who have been systemically oppressed for years? That's why this message is important today. It gives hope. It gives a path. When I got diagnosed with HIV, and I'm gonna cuss right here, I remember being in that room at Crossroads and said, what in the hell am I gonna do with this? I didn't know what to do with it. But when U=U came along and I first heard this message, it gave me a path. I'm now determined to do something, reach undetectable. Once I do that, I know I can't transmit anymore. So I'm no longer a part of those people that's giving out the package. That's why this is important. We can't dismantle stigma until we give a solution to what the problem has been. And the real problem is lack of education. Really, it is. It's lack of education. So a message like U=U, which is an educational message first and foremost, is so important on a day like today because it puts the issue in our faces. We can't just skirt around it anymore. So that's why this is important to me.
Right. Now y'all know that LS is a minister. I don't know if you told them. But y'all heard it in the voice. You heard it. He mentioned it, U=U gives us a path, and that's what we're looking for though. We're looking for that path to end the epidemic. We're looking for the way to get down that road. Deja, if you don't mind, let's have your input.
Today, specifically, very important here in Jackson, Mississippi, very important because as many of us know, 22 years ago on this day, Dr. Mark Colomb, the founder of My Brother's Keeper, and another, a bevy of gentlemen went to the White House. I was about to say the state capitol. I couldn't get past Mississippi, pardon my block. The White House, and basically said, the science of HIV transmission is excluding us. And it is relevant in the data. You cannot talk about fighting HIV without focusing specifically on Black communities. Additionally, Black MSM or Black gay men, and overall in the South. So 22 years has passed and we have grown and we have learned and we have modified. But the difference between the partnership that you are establishing now and where Dr. Colomb was then, what he was doing was chasing the science because the science had already taken off without us. They didn't include Black people. They didn't include the Black gay men. They didn't include transgender communities. They just excluded everyone. So he stopped the conversation to say, in order for you to get a solution, we have to be a part of this conversation. My Brother's Keeper was established in that same year. Other organizations across the country dedicated to reducing HIV transmission in Black communities, specifically among Black MSM, were established. Fast forward 22 years. Now you're here. And what we're doing is we are adding the story to the science. We don't have to chase the science. The science is right here in the room. You're here in the room. And we're gonna create a narrative that includes all of us right now. So that's the reason I think it's so important on this day here in Jackson that you're fostering this relationship to educate people about undetectable means untransmittable. One, creates a safe space of empowerment for people that are living with HIV. But for other people that are not living with HIV, what it does is it kills all of your stigma. You don't have any, all of the things that you pretended to be afraid of. Hey, how about this? Below 200, now what? You understand? So, and those are the conversations we're having right now, not 20 years after, you know, the science was established. So I'm really excited about the fact that the relationship that you have with our champion, the Department of Health, is going to allow all of us to have parts of that conversation to add to the stories or the narrative that we're creating here in Jackson, because ultimately you're impacted either way it goes, and it's all of our fight.
And you're right. We can all be like champions for the, like in a part of the narrative.
It's
like
necessary.
Be a part of the narrative. Everyone here has a place in it. Every community member. I'm talking child on up. So you make such great points there. I'm going to move on to another question, and this question is going to be directed, I think, LS and Dr. T. Okay, so LS, if you'll jump in first. The question is, How is mental health related to HIV stigma? And how does U equals U apply?
It's a loaded question. There's some good questions. Okay, I'm gonna switch to the mental health peer part of me now. Y'all, on paper, I have lived with some things in my life. Okay, I have. As Dr. T said, she's the keeper of secrets, and it don't ever go quite well with us on panels because I tell my own secrets. You know, that's my agency. But mental health, I'll put it to you like this: when I first got diagnosed with HIV, I was delusional. I was in denial. Now, mind you, I had been talking science, I had been talking prevention, but when I got diagnosed, it was like, okay, you know, how do I navigate this with my mental health? So first and foremost, I had to make some decisions, okay? The biggest piece for my mental health when I got diagnosed was taking that assessment. I took a piece of paper, white piece of paper like this. On one side, I wrote everything about myself before HIV, including mental health issues, including things that I had lived with. Flipped the paper over and the value was the same on both sides. So I knew that living with HIV did not have to derail my mental health or cause it to decline, but I knew that I would have to put some more preventative measures in place to keep my mental intact, because you're depressed and can't get out of bed, you're not gonna take that pill. I won't say you, me. I stopped taking medicine because I was depressed. So keeping my mental strong is the direct key to my adherence. It really is. So on a day like today, and thinking about Black people who iconically have shied away from mental health, you know, we come from the church world of Jesus is the wonderful counselor. You know, I remember even when I got diagnosed, I went to talk to my pastor to say, I want therapy. I want to open up and talk to someone now. And therapy was discouraged from a religious standpoint. And so for those first 2 years, I wasn't adherent. And I found myself in the hospital with meningitis and a whole bunch of other stuff. But it wasn't my body that was the most affected. It was my mind. So you can't do treatment and adherence in HIV care and not focus on the mind too. It's impossible.
Oh, exactly right, Ellis. Dr. T, if you want to touch on that question, I can repeat it for you. How is mental health related to HIV stigma, and how does U equals U apply to that?
Stigma. Stigma.
Stigma.
That's what connects mental health and HIV. There's so much stigma attached to both. And so what I said earlier about all of us have a brain. We all have mental health. Do we want to be healthy across the board is the question. So you have to look at your brain as well and take care of it. How many of us go to the doctor every year to get our yearly physical? Everybody goes to the doctor every year. Your brain needs a doctor every year, just like I go get my yearly checkup. So that helps with the stigma. Historically, Black folk. Okay, I was trying to see how to okay, my people. What goes on in my house stays in my house. Or we don't provide a safe space for people, or we body shame, or you sound like you white, or you know, these are the things that we have historically done to perpetuate the stigma that happens in our community. I worked in HIV for a long time and didn't realize why I got into it until it knocked at my family's door. And I can remember being that person for my family member and then having to educate other members of the family as well. So stigma connects it, and why it's important to have mental health is to help people stay sane, if nothing else.
Right.
To keep their sanity, because again, if you can be well in your brain and have mental wellness, then the rest of you can help out with the rest of you as well.
Right. That brings us right on back around to that car, you know, and aligning and making making sure that we stay aligned.
You have to be.
Right, exactly. We've got to dismantle stigma.
We do.
You know, I've heard a lot about it today in several different webinars and the one that we were on this morning. And I've heard about stigma and we talk about stigma, but until we do something
Yeah.
about
Mhm.
stigma, we're not doing anything.
Exactly.
Mhm.
And we have to learn how to be able to call people out when they're out of
When
order.
that-
Yeah.
When
Call
you're
a
out of
spade
order.
a spade. My
Yeah,
grandmama
when
said it, you
yeah,
know.
If
Say
you're
it
out of
again.
order, you just out of order, and I need to
Exactly.
lovingly
Right.
help you
Right.
understand how you are hurting,
Exactly.
hurting the hurting
Right.
people that are already suffering.
Indeed,
Mhm.
indeed. So we'll move on, and this question is directed at Deja and Melverta. We'll start off with Deja, and the question is, why do you believe that HIV has disproportionately affected Black, Brown, and other marginalized communities? Why do you believe now? Not
This
us.
is me. Everything that I'm saying does not necessarily reflect the.
And disclaimer
Right.
there.
And I hate to just keep reiterating, and I'm gonna say stigma, but I'm gonna explain.
Sure.
And in my mind, and I'm gonna go around but I'm gonna come back to the house. Everybody gonna get there on time. Most Black people in America of African descent came to America from the South. So when you talk about Black cities, when you're talking about Houston and Atlanta and Chicago and Detroit, New York, their lineage, all of those places, as far as I'm concerned, are upper Mississippi, okay? So all of our stigmas, and I know this may not be a popular conversation, but stigma is based in fear.
Indeed.
And the reason that we have certain stigmas are to keep us safe. And I'm talking from my lens is African.
Mhm.
If as a mother, my child being jovial could get them spanked, lynched, or sold for being noisy, I will tell him, shut up,
Mhm.
be still, be polite, don't ask questions. And so we instill these things with their children, and then they teach their children, and their children teach their children. Some of the stigma that we amplify is based on our Southern upbringing. Our Southern upbringing, the Black Southern upbringing, is based on oppression because most of us came here through a portal of slavery and rape and brutalization. So when we're talking about the stigma and how it's, impacting chocolate cities, most of us are still dealing with the same stigmas and we don't even know the roots. I remember one time I saw somebody chewing gum in the sanctuary and I'm old school missionary Baptist. I remember sitting there doing like this. Somebody gonna do something? And as I was sitting there, I was like, why am I tripping about this woman chewing gum in the sanctuary? That's what I was told. So a lot of the dismissiveness, that's what we were told to do.
Right.
Stay away from you to keep me safe. You're different from me. I don't understand you. Just keep your distance. And then if you throw a little Holy Ghost hot sauce on it,
Right.
Okay, now.
what we also do is we find safety in knowing that oppression or suffering is going to get somebody
Right.
as long as it ain't me.
Right.
So if it's getting you,
Right.
I'm okay. Me and mine are fine.
Mhm,
And we're doing that amongst each other in Black communities now.
mhm.
We are dividing ourselves into gay and straight. We're dividing ourselves into poor and rich, as if light skin, dark skin, like infectious disease cares anything
Right.
about that.
Right.
And if we are isolating, one, if HIV is impacting gay Black men, that's a gay Black man problem. If HIV is impacting Black folks, well, they're not talking about HBCU educated Black folks. They're talking about, drug use.
Right.
So, and we do that for safety. If we recognize the reason that we're doing it and how empty it is, then maybe we'll get to the root of the stigma and let the science pour in.
Mhm.
And that's what we need in Black communities. Those barbershop and beauty shop conversations. I mean, if you get a good sew-in, that's a good 4 hours in the chair. You know how much information I can give to you in 4 hours?
Right.
So to go back to those spaces, and everybody's a change agent.
Yes.
Everything on the internet is not the truth.
Right.
But the Department of Health will give you all of the factual information that you need. We have epicenters where Black people are, Black epidemiologists, physicians. It's not like during the Tuskegee experiment where we didn't know what was going on. You know exactly what's going on. You have people that work at CDC that come home for Thanksgiving and sit down with you. So to have these conversations where you're letting the science lead and everybody has to do it, especially young people, because when the old folk like Gerald, when we talk about it, it sounds antiquated, like it's an old idea. HIV is impacting young Black people. So we also, as the adults in the room with all of this science, listen to them talk to us about what they get and what they don't get, what sounds crazy, so that we can actually insert science into those young cocoa conversations.
Right. Thank you, Deja. You mentioned something that made me think about, we have to know where we came from in order to know where we're going. In order to get there, you know, there's absolutely no way we're going to get there. Oh, exactly, exactly. Point well taken. Indeed. Melverta, why do you believe that HIV is disproportionately affected Black, Brown, and other marginalized communities? You, ma'am.
Okay, I work for the Mississippi State Department. There's so many things going through my head because I am old enough to remember, and I've said this before, where instead of 1 pill a day for someone who's HIV positive, there were 10 or 15, 20. And because of the daily regimen of taking medication, people were not able to work. I'm old enough to remember support groups that I would go to as an invitee from the health department when I was HOPA coordinator many years ago. And in the room, in the support group were white, yellow, brown, Black. Some of them had on suits, some of them had on scrubs, some of them worked at banks. These were professionals. And stigma at that time, although it's a word that was known, it was kind of foreign. People were trying to articulate what was happening to them. I think about one young lady who talked about she'd had to get up and go to the bathroom to take medication. And so, you know, during those times, people were watching how many pills you were taking a day. And I heard someone say the package earlier. We used to say that, you know, trying to explain things, but someone at her job started going to the bathroom with her or popping in and seeing her take the medication and, you know, just take medication, period. But put out there a rumor that this individual was HIV positive simply based on the amount of medication she was taking. That's stigma. Now, many of us take several different types of medication and no one says a word. But at that time, it was foreign, it was different. But the difference between Black, Brown, people of different colors, and Caucasians, and I have to say it, is when they realize, or any group realized that it was taking out a whole community of people. They didn't just mobilize themselves, they mobilized their partners, friends, family, how to address it collectively. They did not act divisive, because it's a scary thing when you're thinking about generations of people being wiped out. We didn't have time to consider that because we're so busy living, trying to feed our children, trying to make ends meet. And for that, there was stigma related to that we didn't take the time to take care of our health. So there's something wrong with that. If African-American men are getting HIV at disproportionate numbers, there's something that they're doing. You know, they're all having sex with one another, but that's not true. HIV, you have a network of people. Say there's a group that resides in one zip code and they all know each other. It only takes one, and we call that a cluster. You know, it could be an outbreak. There's stigma related to that with certain population groups, certain zip codes. We've done zip code studies. If we don't stand up One of the things we all did when we worked with Mississippi Urban Research Center, community mobilization training, we traveled all over the United States, helping organizations and people in communities figure out how to mobilize to save their communities. If we don't mobilize and stop, and dare I say, infighting, you know, being tertiary, we're not going to get to where we need to go. Ending the HIV epidemic has given us an opportunity not just to deal with HIV marginalization, stigma, and discrimination among us, but it says we need to help our brethren, Native Americans, the Latinx population, those groups that in our minds, we think this is a Black problem and we're not thinking on the outside, but we have to. We have to. There's stigma related to that. There's cultural stigma. You know, people are being killed every day because they want to live their truth. People are committing suicide because they can't live their truth. Stigma is a killer. I was listening to Talya talk about stigma and mental health. When in the early years when we were working, we would talk about the fact that it was important for people who were HIV positive to manage their stress. Stress was the biggest killer of people who were HIV positive because they were trying to manage everything and also keep some privacy for themselves. And it was very difficult and people could not live that way. Stigma takes many forms. We all have it. We have to check ourselves constantly. You know, because I've been around for a while and I've seen a lot of things that some of my colleagues in the room, we've been doing this fight for a very long time and we could tell stories. I hear Deja talking about antiquated. People these days, they really don't know what it looked like. And to us, it doesn't feel that long ago. It really isn't, I guess, when you think about it, but it was such a different world. There's no reason that we should be seeing HIV in the numbers that we see it. And then the HIV epidemic says that we all count, we all matter. We're either part of affected, infected, or impacted. No matter where we live, where we work, or what we do.
Right. Thank you. You mentioned, you know, like cultural norms and things like that. I was thinking back about like the days of, you know, the master's program or whatever, when we learned about cultural norms, and it was almost like we were learning in Mississippi, of course, and it wasn't the same until we got our feet in it, you know, to know that it's those barriers to resources and, you know, the things that are actually keeping us from being able to access that care or to get those numbers down or to, you know, to get testing rates up and things like that. So all of the things that you talked about along coupled with stigma is just added on to the problem that we have with ending the epidemic.
Yeah, stigma is a
right.
barrier.
It's huge.
It's a barrier.
Right, it is a huge barrier. I'm gonna move on. And so I have a question that is just for you, Dr. T. Okay, just for you. So you previously worked in the Ryan White Clinic, correct? Okay, so this is just a diversion. What were some of the challenges you saw while working there, and how do you think we can better support people living with HIV after having that experience?
I'm processing. Being depressed and not knowing it's depression and not knowing, can't put a finger on what this is. I feel like this, my thoughts are going this way, but I still have to be strong. I still have to provide for my children. I still need to go to work. Historically, when I think about my people, we were not given space to feel or to know what a feeling is or to know what an emotion is. Like Deja say, get up, you know, hush your mouth. So if all of those feelings have been suppressed or I haven't been taught those things, then when I'm in a funk or I'm irritated or I'm angry and I don't know where this is coming from, it's because I have a mental illness that is happening with me, but I'm still supposed to be strong.
Right.
So when I was working in the clinic, that was one of the things that I noticed with a number of patients that I work with. We are suffering with depression or anxiety or trauma and not knowing I have been traumatic. Think about it. If I have been told I have gotten this virus, I'm grieving the life I once had.
That's right.
That's a traumatic
Yes, that's
experience. How do I create a new life?
Right.
So trauma is something that that I noticed as well. So giving people the tools to help them work through their depression, work through how they feel about themselves, work through what I'm feeling and not suppressing that feeling, because it's okay to feel what you feel. It's very valid. It's what you're gonna do with it once you feel it.
I believe maybe this is not just the answer totally, but there has to be a continuum of care because there are other people, there are other entities that are going to be able to take that and you know, and move that along.
And that's one of the things that I think having integrated mental health into primary care is so important, and not just with HIV, but just in general, across the board. I think it's important to have different the different phases of health. You need mental health at the table, you need physical health, you need all of these people at the table as an integrated team in order to deal with a person.
I say this, I know we've all heard, oh, she crazy. And then go, we don't want to hear that anymore. You know, it's more than just that. It's more, it's not that. Don't let me say it's more than just that. It's not that, you know. So moving on, Ellis, would you discuss for us, let's see, something, I think I got one. Okay, we've heard a tremendous amount about U equals U, right? Shameless plug. But what exactly is the journey to 400,000?
So there are 1.2, roughly 1.3 million people in the United States living with HIV right now. Data has shown us that there are 400,000 people, probably more in my personal opinion, that are living with HIV that are not yet virally suppressed for a number of reasons. And for so long, it's just stayed that, a number of reasons. People have their reasons for not. The journey to 400,000 is about cracking those reasons open and looking at people, looking at the issues, because if we do not do something about these 400,000 people that are not yet virally suppressed, by 2030, we'll see another 400,000 or more. We'll be at nearly 2 million people in the United States living with HIV, but yet we have a challenge to end HIV, new transmissions of HIV, which that number is down to 3,000 a year. That's still too much for me. But if we don't focus on these 400,000 people, getting to the mental reasons of why folks aren't virally suppressed. Are you not taking your medication because the household that you're living in is survival sex? And if this person finds out you're taking medicine, you can get killed. Like, these are reasons that we're gonna have to crack open. These are the solutions that we need to address the 400,000 people that are not virally suppressed. So that is the new aim of Prevention Access Campaign. That's the direction that we're moving in, to use this message and this tool to help folks get in care and stay in care. That's the best way to put it. Get in care and stay in care. Get undetectable.
Thank you, LS, because sometimes we have to put it in a perspective of numbers. You know, we don't all the time have to see numbers, but just sometimes when you can't quite gauge what it is, hearing that there's still 400,000 people who are unable, have not reached viral suppression. That lets us know what we got to do. We got to know where the work is at before we can do the work. Where's the work at in the journey to 400,000, right?
Oh, Zundra, and let me add, Mississippi is one of 7 states.
Mhm.
When we look at this roadmap to ending this thing, Mississippi is one of the 7 states. So this is for us. We
This is
gotta do this.
directly for us. You're
Yes.
right, Ellis. Deja, this one's for you, okay? And I know we're moving towards, this has been some good conversation because I didn't even have to tap y'all twice with your own questions, so this is good. As we move on, Deja, how can MBK, my brother's keeper, and other clinics in Mississippi use the message of U equals U as a tool for community mobilization?
Send a whole bunch of t-shirts with Gerald on the mobile unit and let them throw them up and down. Well, I'm joking, but this, it's 2 things. And I appreciate the message, and to simplify that message everywhere we go. Like when we got the PrEP go, we were out the gate, everybody, didn't matter who it was. We were talking about PrEP, that 1 pill you take once a day to prevent HIV. So this is a tool, not just to educate those that are living with HIV, but everybody else. I need you to understand what this is. I need you to educate everybody else so y'all can, stop being so stigmatizing and ostracizing and condemning. Because if you create an environment where someone who is living positive, they've decided that it's too stressful to stay adherent, that it's, too much of a hassle to stay, you're a part of the problem, not the person that's living with HIV. It's you, you being the actual barrier. So what we can do is one thing, but we can't skirt around Jackson and its environmental factors. I'm sorry, I have to say it, because even with the greatest solutions, this. Poverty is a social determinant of health.
Yes.
Our income levels are so low here in Jackson. We have dialysis clinics all over the place. The fact that we are creating dialysis as a solution and not creating healthier food options in the city to upstream it is a problem. Check cashing places and payday loan places are all over the place. That means that people are not making a living wage and they're having to borrow against themselves, but there's no solution to the problem, just a Band-Aid for it. So as we insert U equals U in our narrative, we also have to understand that if I'm living positive, if I am on my medications, I can live well and I can be undetectable and I have no capacity to transmit the virus. And I still have diabetes, and I still have high blood pressure, and I still don't have a car, and I'm still making under a living wage. Right, it's still violent. I still, as a Black person, find myself going into spaces where I'm just Black, but there are cops here. Like I'm at the vegan food truck. Well, why are police here? It's because Black people are here. So those environmental factors, I'm hoping that in the process of us inserting the solution, we still don't forget the fact that policy change creates healthy environments. So as we insert U equals U into the conversation, also encourage people to understand it ain't just you. A lot of the decisions that we make are impacted by our environments. And in Jackson, we've got all of the indicators of all of the unhealthy stuff, but U equals U gives us a tool to use to change the narrative while we change the city of Jackson.
Right. Well said. But even that janky car that Dr. Talya had didn't take just one tool.
Amen. That's
So
right.
as you spoke about all the things along with that, we have to put it together and we can move forward when we couple together. That comes with our partnerships and our collaborations and things of such. Thank you. So Melverta, I know that our time is winding up, so we're going to end with you, and I have one especially for you.
Okay.
How can organizations become a community engagement partner with MSTH under the EHE?
Are you asking about the money?
Not necessarily.
No, I'm sorry. Oh my goodness. I would say, first and foremost, connect with me.
Yes.
I am very busy and sometimes it's hard to get me. Send me an email and I will do my best. I'm trying to build a team. people have contacted me about wanting to be a community engagement partner. And one of the things that I've had to stress is that what EHE wanted from our federal partners is to support organizations that had not been funded before through the health department. Those, those voices that those of us who don't have the expertise sit around and talk about, but those voices are not at the table.
Right.
So our partnerships, for example, with Immigrant Alliance for Justice and Equity, I mean, I just can't even explain, even talking about it now gives me chills to be able to see this day. We collaborate with the Latino Commission on AIDS. I'm gonna soon be having a meeting with the band of Choctaw Indians
All
to
right.
reestablish that.
Yes.
So these are partners, but while everyone wants to be part of EHE and, you know, we had an EHE task force, the truth of the matter is how we tackle HIV is not the way we've been tackling,
Right.
HIV. We have to have those statewide voices, those state partners, someone who is from financial institution, the Department of Corrections, mayors in cities with the highest case rates of HIV. Those are the people who can help us make the serious impact that we need. And while those of us in the community, because I came from community, are still relevant and important, but the people that we have not had in the room, at the table, on the virtual platform, we have to hear from them. Because if we're saying that, HIV is technically in everyone's backyard and it's just waiting for an opportunity to show itself, that means everyone has to be receiving the same message, no matter race, sexual orientation, gender, none of that should matter anymore. Because if we're impacted and affected, eventually it's going to spill over. When I was working at the American Red Cross years ago, we, myself and Juanita Davis, we used to draw this circle. And we, carve out what percentage was African-American women, Black men, gay white males. And we would say, at some point, this circle is going to shift. We're not sure when, and we have seen a shift. It may end up, the needle may end up someplace else. And all of the knowledge that we have, because African Americans been dealing with HIV for so long, when that time comes and another group needs our help, we don't need to say, it's not our problem anymore. We need to still take everything we've learned and apply it to that. We may be a subordinate group as African Americans, we may be facing stigma and discrimination, but we're here.
Right.
And our voices are strong, but they're only as strong as how we decide to mobilize ourselves and act on one accord to be one voice.
Yes.
Let's stop HIV together.
Yes. Thank you so much. That was a great wonderful discussion. I brought that last question simply because it has been amazing for PAC to be able to join with MSDH. It's felt good to have our feet down in Mississippi, where is my home, and I don't have to reach all over and everywhere out of state to try to make some impact. It feels good to see your own people.
I do want to add something, and this is about me. So PAC, this partnership came about because we were on a virtual, it was some type of meeting, right? And I don't know if it was Cameron or Murray, but somebody said, whatever they were doing, this program was going to end in April. It was going to end at some point. And I got in the chat and I was like, contact me, please. What? Because I'm just getting used to the idea that PAC was around. And it was because of that, not wanting to lose whatever they had started, that I reached out. And I said, we talk about U equals U in our EHE plan, the national strategy, it's mentioned everywhere. Why don't we have a partnership? And so that's how this relationship, this partnership evolved, because I didn't want them to stop doing the work that others have become, felt that was of value. So everyone can, partake and see how they fit in with the campaign now that we have people in Mississippi working with it.
Well, that has been amazing to work with you thus far, to have been with MSDH. Excuse me, I'm getting tongue tied. I
That's
think
all right.
maybe I'm a little bit. It felt so good to hear you say that, because that's the way we feel, honestly.
Yes.
So as we have concluded our panel discussion, we want to take, if we have a little bit of time for any questions from the audience. They've given us all of them, they've given us their heart and soul. And then, of course, we have some, maybe possibly virtually, have one question virtually. Let's just see, do we have any questions in here? Okay.
Yeah.
Yeah, so I've been taking notes. My name is Marty, and I'm on the committee for Capital City Pride. And I'm our executive director, was supposed to be here, but he had a personal family issue. But my question is kind of like also a statement. So we're doing advocacy work now. Organization started as like an events organization just to create a safe space and a safe environment for those in the LGBT plus community. But now that we are past that, we're really getting into our advocacy work. And so last year we had our inaugural festival. And there's been organizations within the city of Jackson, and we did our own study. And also I want to shout out Love and Miss Dot here. They were also on the committee with me, the inaugural committee. And so with our study, we found that there are a lot of adolescents in the Jackson metro area that have not even heard of PrEP, that are sexually active and not being tested. What can we do as an LGBT organization to have a conversation to start that education? Because I know, I think it was Ellis that said that we can't dismantle stigma until we have a solution, and the solution is education. But how can we educate those when the education system in Jackson is so broken?
Oh, there's Valencia.
So I'm sorry. The actual question, it was right before I turned around, and I'm sorry.
The question is like, how can we do advocacy work and include the education of PrEP and sexual health within the Jackson metro area?
How can we,
especially for adolescents?
okay, how can we do advocacy work and include PrEP, especially in the Jackson and metro areas? Are we talking about, you said for adolescents, correct? Okay, I'm repeating it for our virtual audience, so excuse me, you may have to take me slow like a minister on Vows Day. Go ahead.
I think I got most of the
Sure,
question,
Deja,
and
go
correct me
ahead.
if I'm wrong. Are you from Mississippi?
No, I'm from Louisiana.
Okay. Well, I think that our allergy to sex within the public school system is a tad bit deeper than yours in Louisiana. And that's one of the biggest problems, that we can't get into the schools with young people and insert any conversations about sex, sexuality, gender, or identity.
Because they're not having sex.
Because no one's having sex.
Absolutely.
But what we are finding is that, and MBK has a program called Future Ready. And what we did as a novel idea, we're gonna bring children or youth, I won't make them mad because young folk get not cheering, they youth, the youth together with their caregivers, and then separate them into two different learning environments, but give them the exact same extremely candid at MBK, we do it like Tina Turner. Some of them do it smooth, but we do it rough. And we have a very candid conversation. One, it's data driven. Two, it's very candid. Three, it opens the door for all of these conversations. The young people want to talk about anal sex. Now they have a safe space to do it. The adults don't know what Pornhub is. Half the adults are like trying to figure out how come you don't know, and showing them how to get to it on their phones. So, and the end result is young people who have the information, which is most important, and I don't know what it's going to take in order for us to mature our public school system in
Mhm.
Mississippi. That's a long road to hoe.
Yeah.
But until we get
Mhm.
there, the kids eventually do come out of school. So we get them out of school, include the caregiver in the
Yes.
conversation.
Yes.
Because what you're hoping is that the questions that they have or the stuff that they know, because you know, the kids, y'all young folks love to tell grown folks what y'all know. We're hoping that you'll tell us what you know
Mhm.
and we'll learn
Right.
and we'll share with you. And so now we've created the safe space to have a sexual conversation. So when the other stuff pops up, okay, well, we've already talked about anal sex and Pornhub. Let's talk about this. And until our education system
Mhm.
catches up. Now, I'll say shameless plug. My son is a student at a local church school. His former headmaster and I used to talk about HIV, sexual and reproductive health all the time, very open-minded man. And before he left, they implemented an early sexual and reproductive health curriculum. It's one of the only elementary schools in the state
Wow.
that is doing this, and they implemented the curriculum this year. So in the process of educating young people about their bodies first,
Mhm.
you know, as just by itself, not before it bumps into anybody and does stuff that happens with bump into people, to educate them about the body,
Yeah.
which is biology. We don't even do
Right.
that with the kids in school
No,
anymore. Like we're
yeah.
walking around with all this stuff and you don't even know what it
Know
does.
what it does, right.
But if you're a woman, you're told just to hold it and a man will tell you what to do with it. But that's another
Right.
conversation. But if we get to the point where we understand we can't get in the schools because of what it is right now, meet them outside of the schools, create wonderful, safe space, exciting environments for them to come and talk to health educators about sexual and reproductive health and let
Right.
them lead the conversations.
Right.
They can really take the conversation somewhere.
Right.
Yeah.
Organizations such as, such as yours. I think I said I was the founder of Cry Out Teen Organization. We work directly with transitioning children from even now we've added on preteens to go to teens to college. I watched my own son go through this process. So there's always opportunities and we talk about those tough questions. We talk about them head on, and so there are other organizations, not just mine. So pairing with those types of organizations and getting involved. And it is a long road to hoe to get to that point where we are going to be able to get in there. It'll be slow, but it'll happen.
It'll happen.
It's going to happen,
Right,
yeah.
right.
But for now, I agree with exactly what you said.
That was a great question.
Any more questions
The
from the
virtual
And
audience?
I want to add
Oh, sure.
something even just even more practical. In your school districts, run for those offices
Oh,
like
yeah.
school board,
Yes.
city council,
Mhm.
mayor, run for those things that traditionally we've let other people do those things for popularity or
Yeah.
I want to be in power. But we need people in those positions who will do the work and have
Insert that type of
community
logic, right?
involved and
Mhm.
not.
Basically, it stems from stigma again, because I remember in high school, I was a nerd, so I learned about sexual health. Well, I mean, I had a conversation with my dad, right? But
Right.
I also took AP biology,
Mhm.
and we talked about the body's organs and reproductive sex. And then when I did some mentorship here, they were like, "Oh no,
We don't do
know
that.
about
Talk
about that.
Yeah.
I was like, "What?" And I learned this when I was 16.
Right.
So is that also rooted in stigma in the state of
It's rooted
Mississippi?
We don't
Shame.
have sex, baby. We don't do
Tradition.
any of those things in Mississippi. What are you
Right.
talking about?
Marriage between a man and a
Right.
woman is the only place sex is
And
supposed to
missionary
happen.
sex is the only sex you have. Okay.
Louisiana's also
Yeah.
South, so it's like.
Y'all the deep south with king cake and liquor though, that's different.
Yeah.
Deja.
That's different, yeah.
No, but seriously,
Uh-huh.
we're in the Bible Belt, so
Right.
a religion has and look, I love Jesus, but I go to my therapist too.
That's right.
So religion has a stronghold on the mindset and just the culture within itself. So yeah, run for some
And
office.
understandably so. I
That was a
always
good
think
point.
of when we say we're in the Bible Belt, I always say this, like in every presentation that I have, we're in the Bible Belt, we're in the Bible Belt. It has played its part on getting us to where, it has been a strong
Yeah, it
force,
has.
but it also has been a hindrance
Hindrance,
sometimes.
yeah.
And when it
Yeah.
comes to
You
stigma,
have to
it's
have,
in that
you
big
have to have
area.
a good balance.
We have to have a good balance. We
Yeah.
cannot Jesus them to
Yeah.
death,
Right.
so, yes. It's
That's
time to
right.
take
That's to me, that makes.
I
it
agree.
a push to not
Yeah.
Move forward.
Right.
We have a lot of people not going to church. We have spiritual people now.
That's
Yeah.
right.
Right.
Religious people, because I remember just like that a long time ago, when people living with HIV went to church
Mhm.
to talk to their pastor and got put out of church.
That's right.
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 Yes.
Just a lot of folks don't even deal
Mhm.
Right.
with churches, and but we get it culturally. We go to the church,
Mhm.
but that the church ain't there for us no more like that.
Mm.
Some are.
Right.
Yeah.
But not all.
Yeah.
Right, right.
Mhm.
And it is difficult to find a confirming or, and when I'm speaking about HIV, it has been difficult to find confirming churches.
Yeah.
I can't stand up here because I'm trying to find them every day. That's what part of our
That's right.
deliverables,
Right.
So, but with that being said, we all go to church, right?
Mhm.
So if we believe, most of us, I'm not going to say that, Valencia. Most of us, go to church or have some church base, right?
Yeah.
So what I'll say is, if we want to change things within the church, if we're in there, who's the one that's going to change it? It's left to us.
And not just the church, all bodies of faith. whether
Yeah.
it's-
True.
If
True. I speak
most
that.
most
Yes,
bodies
true.
of faith, no matter if you're talking about the Quran, or the Bible, or the
Right,
Torah,
right.
there is
right.
a theme of responsibility to love, period,
Mhm.
point blank.
That's right.
Mhm.
And it's so funny how we'll take the scripture and use it like I'm looking for something to hit you with.
Mhm.
But why
Right.
can't you just use that same energy to find something to love me with? You'll
Same
find it
right.
in there. It's-
Right.
But like she said, leadership matters. So
Yeah.
if you don't run for office, you should become a minister of your own church.
Honey,
I'm gonna touch, I'm gonna grab this question from the virtual. Oh, we answered the
Oh,
question.
we did a good
Look at
job.
Okay,
this
great.
conversation. Are there any more questions from the audience? Okay, all right.
Hello,
Hey, hi.
Tanya. I'm the founder of Awaken Love, where we assist trans, non-binary, and gender non-conforming people towards self-determination.
Yes.
Well, I just recently moved back to the city in April. I left the city 7 years ago because I experienced homelessness here. Had no solutions, no way of getting any resource thing we have.
I know that.
Went to jobs and I was denied because of most people's religious beliefs.
Mhm.
So it left me in a pretty much terrible situation. Well, I moved to New Orleans 5 years ago and I blossomed.
Mhm.
Now I came back here in April and things are still the same for trans and trans people.
Mhm.
So I'm wondering now, what are most health departments doing now for the data when it relates to trans people? I know usually they put trans people under MSMs and trans women are women and trans men are men.
That's right.
I'm wondering now, what are they doing to capture that data so we can also be included and also be at the table?
That's a good question.
So refining the data to collect it the way we need to does not exist yet. We're working on it. But even with that, through EHE, the funding that we've received, we are supporting several transgender organizations, Love Me Unlimited, Life Inc. As a start. They need some support because technically they're kind of grassroots organizations unfamiliar with receiving state funding or federal funding through a state agency. So there's a big learning curve, but it's a learning curve for the health department as well, because it's new territory. And one of the things that I am trying to do is to make sure those voices are at the table. I don't think it's fair for me as an African-American heterosexual woman to be making decisions on what is best for a transgender woman
That's right.
or transgender man or African-American MSM or, LGBTQI. Those voices have to be there. When we're talking about the Latinx community, there's a whole nother culture. Choctaw, you know, being a Choctaw Indians, I've done training on the Choctaw Reservation, and you know, the way they receive and process information. I mean, there's in Native American cultures, there's two-spirit gender. We used to talk about that. So the needs are there. We're supporting that. So you do need to reach out to me, but be patient with the health department. This is new territory. We're learning. We want to get better at it. And we want to make sure that if we're funding organizations that only deal with care and treatment or heterosexual populations or African-American MSMs, that we don't want to just talk about those target population groups. We want to make sure that we support them as well. So there is support. It may not be a lot of money, because sadly, there's a lot less money in prevention, even though that is the message that we promote all the time. And there's a ton of money in care and treatment. You know, I call it the after the fact funding. And it just, you know, it kind of concerns me, but we're doing the best that we can with what we have. But yeah, reach out to me.
One
Reach
thing
out
that
to
I've
me.
noticed since I got to know, well, I've known you since, you know,
Yes.
back in the day,
Back in the day.
but school day.
Yes.
But since I got to know you through the MSDH past when we worked, you know, prior, but is that you have been trying very hard to think outside of the box. And I heard a gentleman the other day say on something we were on, and they said they heard someone say, like, don't think outside of the box, just get rid of the box. And I have seen you try to do that over and over again. So I'd like to say that we are kind of in the right hands here, you know.
I'm not
We're
very popular because I keep pushing that agenda with some old heads
well,
who, you know, who are just used to things being a
Right.
certain way, but we
there's
can't
no
afford,
change with that.
yeah, we
Yeah.
can't afford to oprate the way we did 15 years ago,
Right.
10 years ago. I
Right.
mean,
Last year.
even 2 years ago,
Right.
pre-COVID.
Right.
And I do want to make this clear to everyone. There is a correlation between syphilis and HIV.
Mhm.
The numbers for syphilis are increasing exponentially.
Say that again.
The numbers of syphilis are increasing exponentially. I get calls and emails from organizations and clinics saying, this is what I'm seeing. Is it only here? Is it someplace else? I'm saying that because when we begin to see a lot of syphilis, we're going to find HIV.
Right.
So my message is get ready.
Mhm.
The more hands on deck that we have, you know, we're building a partnership with the FQHCs. All of them have mobile units. When we have clusters or when we need screening or testing, MBK does that for us. Care for Me, AIDS Healthcare Foundation, if they have a mobile unit, they're going out. Now we have that with the FQHCs, if we have a cluster outbreak. We're trying to develop a plan for syphilis, STDs, and viral hepatitis. There's more hep C than any infectious disease. But I'm putting that out there that when you are looking for funding from the health department now, in the STD HIV office, all of those pieces overlap. So as Zundra has said, you know, throw away the box. We're looking for innovativeness, something that ties in everything that contributes to perpetuating HIV as it exists in the South, in Mississippi, and the United States. So it doesn't matter who you are, where you are in your life, what kind of help you need, you know, reach out. Even if I can't do it, I can make the referral to someplace else.
Well, okay, you guys, we have come to the end of our time, and it has been, I mean, I've enjoyed myself. I can't speak for everyone here. Looks like there's still smiling faces. I didn't lose too many. And we didn't do our panel in, so, you know, if there's any other time that maybe we could ask you back for anything, or, you know, we definitely will. I want to thank everyone for coming out. I did want to make just one announcement, and I just wanted to say thank you to a colleague of ours, Cameron Kinker, for coming all the way down. Mississippi, and we got him to say, he's saying y'all now. No, but it's been a pleasure to work with him along with this project. I hope to work with each of you in some capacity. You know, you may not even have your organization going yet, you know, but seek us out, you know, talk to us, and I'm gonna let you get out of here. We've held you long enough. Thank you all for coming.
Thank you.
Thank you, thank you.
Get this jump. Get Zundra. Tell him to get that jump. Tell him to get that jump.